Hello, and welcome to another episode of the Break It Down for Brackens podcast. Today, we get to talk to Dr. Matt Hahn. He comes out of Berkeley Springs, and he is running for Congress, U.S. Congress, in District 2 in West Virginia. He's coming at it from a healthcare point of view, and he has an extremely compelling discussion. I barely did any talking. It was amazing. He literally checked every box, every question I had, he answered before I had a chance to ask them. He has a lot of passion for what he's doing. He sees the ability to change things. He sees the ability to have both sides of the aisle working together. Let's listen to what Dr. Matt Hahn has to say. Dr. Matt Hahn, thank you very much for being on the Break It Down for Brackens podcast.
You're welcome, Kevin. Nice to be here.
Thanks. So let's just jump off on the same question I ask every single person at the beginning of all of these is, tell me about your background, both professionally, personally. If I recall, you're also in a running group, is that correct?
Oh, absolutely. Running's a very big part of my life. I guess I'll tell the Matt Hahn story and how it leads up to becoming a candidate for Congress, because it's really a thread that it goes a lot of different places, but it all comes together. So I'm a family physician. I live in Berkeley Springs, West Virginia. I've been living here for 20 years. I have a family medicine practice in Hancock, Maryland, a wonderful community-based practice. And now I'm running for the United States Congress in West Virginia's 2nd District. But none of this should have happened. The story, I guess, starts a long time ago. In the 1980s, I was in a great rock and roll band in the Washington, D.C. area. I grew up outside of Washington, D.C. And when I was 18, I joined a rock and roll band and thought I was going to be, the idea was to be Mick Jagger. Thankfully, I met my wife, who I think was, probably only interested in me because I sang in a band. And because of that band, I went from being, I think, an uninformed kid to somebody who traveled the country, who met lots of interesting people, who did things that were very much unlike anything I had done before, and made a lot of good music, and just changed my perspective about things. Also, I was the manager of that band. It was very much a DIY, do-it-yourself kind of effort, and it taught me a lot about independent thinking. But the band broke up, and so I didn't go on to become Mick Jagger. The band broke up in 1988 or 89. I had been going to school. Well, I had dropped out of college, much to my parents' chagrin. I'm one of 5 children, the youngest of 5. 3 siblings who went to Ivy League schools, a psychologist, 2 attorneys, and I was a college dropout. And but I was because I was managing the band, I was taking some business classes on the side, and because of that, I guess one of my side gigs when I was in the band, we all had day gigs, and one of my side gigs was managing an entertainment company in Washington, D.C., real interesting company that provided all sorts of performers and entertainers for special events, including, anything from kids' birthday parties to presidential fundraisers. So I, was working in business sort of on the side of the band. But when the band broke up, I had to think of something new to do, and went back to college, not really sure what I was going to do. and really struggled for a little while, and then, you know, just struck upon the idea of medical school, which is, it's a long story, but decided to go to medical school really because of a family problem that developed, which was, well, a challenge, let's say. I was thinking of actually going to chiropractor school, and my wife and I were going to move away, but she has a daughter who had been living with her husband, my wife's first husband, and she had come to live with us in, I guess, around 1992. And because of that, we didn't want to leave the Washington, D.C. area for a while. And so all of a sudden I had some extra time on my hands, and decided, well, maybe I've got time, I'll go to medical school. And went to medical school, and always thought about being a family physician. I was really, really blessed. I got a scholarship for medical school called the National Health Service Corps. And the National Health Service Corps paid for my entire medical education, but it required that I go into a primary care specialty, and that I had to pay back 4 years in an underserved community. And that's how I got to Hancock, Maryland, and Berkeley Springs. My wife's family is from Pittsburgh. My family's from the DC area. I had to find an underserved community that made sense for us. And there was a small community health center in Hancock, and that's where I started working.
What year was that?
That was 2000. So I got out of medical school in 97, did a residency in York, Pennsylvania, and started my professional career as the medical director of a community health center in Hancock. And, you know, it was really interesting, because back then, doctors were being taught that politics and business was not something that we did, that practicing medicine was pure, and that our job was to focus on patient care, and that was it. And healthcare was pretty good back then, so it seemed like that's what we could do. You know, your biggest challenge back then was trying to diagnose and treat patients and how to keep them healthy. And I really got involved in that. I was head over heels involved in community health. I'm a runner, and I've been running since I was a teenager. And believe it or not, one of the things that helped us decide that Hancock was a good place to work was the C&O Canal towpath. You know, it's the world's greatest running trail. And when I saw that, I was sold. And so I was convinced back then, when you know, the big concern was, how do you keep people well? And I was convinced that what we needed to do back then was just teach people to take better care of themselves, that the big problem in medicine was that we were disease-based. And I was really struck by the fact that all day long as a family physician, I was taking care of people who had preventable conditions, that really what drove my practice: high blood pressure, high cholesterol, heart disease, diabetes, cancer. These were diseases that were rooted in unhealthy lifestyles. And I thought, well, the big problem in medicine is that we're really just taught to take care of sick people. We've got to figure out how to keep people well. So I started community health programs. We did something called the Health Olympics, where we were giving people 2 and 3 month challenges to choose exercise goals, eating goals, weight loss goals. And I thought that the answer to everything that was wrong with us was in doing that. And it was a lot of fun, but it was also very educational. Educational in the fact that I learned it is very, very difficult to get people to change. And the first year that I did that program, we had about 100 people sign up, and God, it was amazing. People did great. But every year, and I did that for, I think, 10 years, every year you'd get more people to participate. And the more people that participated, the worse my data got, because, you know, the first 100, I guess, that signed up were the people that were really motivated. And then after that, it was people that wanted a free t-shirt. And it was a real challenge, but it was a real eye-opener for me too. Going along in, I guess around 2004, a really interesting thing happened to me. It turned out one of my patients, a gentleman named Jolton Jim McCoy, who you may or may not have heard of, who had been a patient of mine since I started, and up till that point had been just a fellow with high blood pressure and smoked. I found out that he was a country music legend, that this guy, Jolton Jim, had a place called the Troubadour. The Troubadour is this great honky-tonk in Berkeley Springs. And Jim opened this place in the 1980s. But Jim was famous. He's very famous in country music for being credited with discovering Patsy Cline. And for 4 years, I didn't know anything about this. He was just a guy who, you know, I took care of every few months. But I went out to the Troubadour and saw this amazing honky-tonk that Jim ran and all the great music that was being made out there. And all of a sudden, it reawakened that rock and roll guy. And I started going on stage and singing country music. And Jim and I became best friends. And Jim was in his 70s at that time. And, you know, the last person that I should have been best friends with. But we made an album together of his music. I performed in his old red spangled suit many times, performing his songs. And for my efforts, I was inducted into the West Virginia Country Music Hall of Fame.
Wow.
But also, I got to know the people of West Virginia who, you know, I grew up in Montgomery County, Maryland, in the DC area, you know, privileged, wealthy people. And I come out here and at first, I guess it was a culture shock. But as a physician, you know, I get invited into people's lives in such a deep level. And I got to know a whole community so different from me. And so many people with my background don't get to know people in this way. And I fell in love with these folks. And then at the Troubadour, you meet, you know, a whole new group of people. And it was wonderful. I mean, you know, and to see people at this bar of every background, rubbing shoulders, you know, getting together over music, over food, over beer. It was joyful, but it was also an incredible education for me about just, you know, a whole side of humanity that I hadn't met before. So anyway, part of my education. Going along in healthcare, you know, in the later noughts, you know, coming into around 2007 and 8, all of a sudden you're starting to see that healthcare is really becoming a different animal. That rather than trying to figure out how to take care of, you know, patients, how to diagnose and treat them, you're trying to figure out how do you get people care in a system that's breaking down. I remember, I don't know, it was 2006 or 2007, seeing patients who, because they didn't have insurance, they were starting to do really things that just blew my mind. I had people who had, you know, skin abscesses, and they were operating on themselves because they didn't have insurance.
Or operating on themselves?
They were opening up their own abscesses. They, you know, they were taking a knife to their own abscesses because they knew either they didn't have insurance, or they knew even with insurance, if they went to the ER, they were going to get this incredible bill.
Right.
And so you start dealing with healthcare in a whole new way. In 2009, we opened my practice. So we opened Riverbend Family Medicine. So I had a private practice, and we started doing things differently. We asked the question, how can we give patients the best care possible, but also how can we leverage the newer technologies that we're developing? I had a software company that developed an EMR, the electronic medical record, because I thought that was one of the keys to fixing healthcare, was a good electronic medical record. But also different ideas about how you can give patients a good experience when they interact with the medical system. How could we stay on time? How could we get people in same day when they're sick? How can we keep them well? And so we had our little practice that was kind of a playground to figure out how we could do things differently from the rest of the medical system.
This small hive of innovation.
Yeah, that was it. It was, especially with our electronic medical record, how could we leverage that technology, but also how could we staff the place differently, so that, again, patients could have a whole different relationship with healthcare. And so what we were seeing was, as time went on, things were really, really falling apart in the greater healthcare world. But our practice was just giving great care. And I guess one of the real lessons that we learned was that while the rest of healthcare is going towards, large corporations and depersonalizing, because everybody has an electronic record, so you can go anywhere, it's transportable. What we found was that the most important thing in people's healthcare was a personal connection. That we're in a community where I've taken care of patients now for 20 years, and as much as what I know as a physician and how good of a diagnostician I am and the great technology that we have, what determines how well a patient does is how well a physician knows them as a human being, and how much me and my staff is probably just as important as me, how much they care about a patient. And we've gotten to a point where our patients are really family. I think of patients almost in the image of my parents and my grandparents. In fact, it's kind of an interesting story. My mom died in 2002, so I became, a working physician in 2000, and in 2001 she became ill with melanoma, and I watched over a year's time as she, was ill and then died, as the medical system did not do well by my dear mother. It just didn't seem to care. It was disorganized and just sort of, booted her around. And I was really dismayed that my own mom was treated such a way by the healthcare system, where I came into healthcare thinking, man, I'm a physician in the United States of America, the greatest healthcare system in the world, and it's going to take care of my mom, and it didn't. And so one of the things that did for me was help me focus as a physician, where I said, I'm going to look at each of these patients in honor of my mom, and I'm going to take care of each of them in the way that I wish my mom had been taken care of. I'm going to make sure that they get good information, that someone's always looking out for them. And so one of the things that we say about our practice is that we take care of our patients the way we would want our own family members taken care of when they go to the doctor. And that was based on the experience of my mom. And I guess another thing that really shaped me as a physician was a mentor. of mine in medical school. I went to GW in Washington. And first year of medical school, 1993, there was a great new class called the Practice of Medicine. There was the recognition that doctors were great technocrats, but I guess our bedside manner sucked. And so there was this practice, there was this new course where we were paired with community physicians. And we were trained how to talk to patients, how to interview them. I guess, the bottom line, how to have bedside manner. And we had this wonderful physician, a guy named Stan Talpers. Stan was probably in his 70s at the time. He was a community physician in Washington. And we just spent all sorts of time talking to Stan over the years. And first year, one day we were practicing interviewing with him. And afterwards, we were just sitting and chatting. And one of the students says to Stan, hey, this is all great. This is great what we're doing, but this is all about what, we practice what to say when things are going well. But, what I'm really scared about is what do we say when things have gone badly? And when this other student said that, I was like, yeah, what do we say? Man, I have no idea. I was in a rock and roll band. What do I say to people when things have gone badly? And it was a great moment. Stan, is this wizened physician. He had glasses, beautiful, crisp white jacket. And he's so thoughtful. And at first he says, well, I'm not really sure what to tell you. Every situation's different. And I was like, that's no good. And then he catches himself and he says, I'll tell you, this is what you have to do. I'm not sure what I say when I get there, but we got to be there. When we're called to that moment, it can be so awkward, it can be so imposing, it can be emotional, it could be scary. And a lot of doctors run the other way. They get someone else to do it. They get a nurse. Our job is to be there with that patient. And maybe they won't remember what you said, but they'll remember that you were there with them. And this turned out to be such a great message for me, because those moments as a small town community physician, happened all the time. Difficult moments, people getting ill, having to impart difficult information about a diagnosis, a cancer diagnosis, or someone dying. And whenever I thought about what I should say or what I should do, it was, I got to be there. I got to be there with that person. And it's almost turned into, it's turned into a lot of amazing stories, that lesson. So you've got these various threads coming together. Matt Hahn, the performer, Matt Hahn, the community physician who's taking care of patients in a broken system that's becoming more and more difficult. The guy who's trying to be there for his patients and looks at them like they're each his mom or his grandmother. The technology side, and then you hit the early 2010 or so, and it really starts to get so difficult to take care of patients that I'm starting to get frustrated. Well, it means that a patient comes in, and the simplest example is a diabetic comes in, and it's not hard to diagnose them with diabetes. And we have all sorts of new therapies. Oh my God, probably 10 oral medications, 10 different types of insulin, new injectable therapies. I mean, the world is an amazing place where in the last 20 years, what we can do for diabetic patients is miraculous. And yet, I can't get any of that for them. I try to prescribe a medicine, oh, that's not covered. Or my copay's too high. Or I can't get testing supplies. Or the bureaucracy to get testing supplies is so overwhelming that it takes my nurses hours to wade through to get people their medications affordably. We have to fill out, reams of forms. And it becomes more and more obvious to me as we go on that it's becoming impossible for me to fulfill my oath. And, you know, and that's when the nation was really starting to talk about healthcare reform. And of course, President Obama gets Obamacare enacted, and it didn't get better. and I'm not politically an opponent of Obamacare. You know, it's a partisan issue, but that's not the way I look at it. It's, did it fix healthcare? And it didn't. And then going along, you know, another few years, and all of a sudden, the bureaucratic side of medicine starts to get so heavy-handed that, again, more than taking care of patients, we're just trying to figure out how to work around a system that seems like it is designed to keep us from taking care of our patients. So there's the notion of something called value-based payment. So the question in healthcare for the past 25 years is, how come American healthcare is so expensive? And when you study the quality of the care in the United States, it's not very good. What's the answer to that? And there's this notion that the problem is fee-for-service medicine. The fact that that I'm paid based on every service that I provide. A surgeon is paid when he does a surgery. I'm paid when I do.
Example.
Well, so fee-for-service means I'm paid for every service I provide. It means that I'm paid per appointment. A surgeon is paid per surgery. And so the notion is, and this notion is incorrect, that because we get paid for volume, that we're not paid for any sense of quality or value. And that's why American healthcare is high cost, low value. And out of that, it is wrong, yes. Out of that narrative, well, the devil's in the details. So out of that narrative comes the notion, well, we will design something that we call, you know, broadly value-based payment, meaning that we're going to come up with measures of value. So, for instance, if I'm taking care of a diabetic, what's the number one measure of diabetes care? It's a test called the hemoglobin A1C. So that's how we rate how someone is doing with their diabetes. This numerical measure. And so, well, maybe instead of paying Dr. Hahn just for an appointment with a diabetic, what we'll do is we'll pay him based on his patient's hemoglobin A1Cs. And that way, and then we can even measure how much Dr. Hahn's patients are costing the medical system. And then we can bring in value based on quality measures, cost, and we can come up with ways to pay Dr. Hahn based on those measures, rather than just every appointment that he has. On paper, it sounds like a pretty interesting concept.
Starting to lose me.
Oh.
It's starting to get bigger and bigger and bigger and bigger.
Well, let's just say that I became more and more frustrated with the direction of healthcare. And more I felt like politics were invading my exam room, where I said that when I started practicing, we had been told as physicians that we were above this, you know, this nasty task of politicking and business. We were there to take care of patients and to fulfill our oath. Well, it became apparent to me more and more that because of bad politics, I couldn't fulfill my oath. That because healthcare was not being fixed, and in fact, it was just getting worse and worse, it was becoming impossible to do my job. And I thought harder and harder about this. And I wrote a book. I thought I became so frustrated, I guess it was 2015, with the course of, I guess, Obamacare and with politics, I thought, my experience in my office is really so revealing, because our office is so small that I see everything, where most physicians today have gone in a very different direction. They now are employed by hospitals or health systems. And so they're shielded from what's happening on the ground. Whereas in our teeny little practice, I see everything, I hear everything. I know the nitty-gritty details of the business. I know the nitty-gritty details of the bureaucracy that we have to deal with, both from a perspective of the government and the insurance companies. I know a great deal about the technology because we use an electronic medical chart that I helped design. And it became obvious to me that there were certain things wrong in healthcare that weren't being discussed by the political system. And so I wrote a book about that. Distracted: How Regulations Are Destroying the Practice of Medicine.
Dr. Matt, this is all very disheartening. And additionally, not understanding how the medical system truly works. Like when you say the politics and the bureaucracy, I'm imagining drug companies twisting the arms of people who write policy to influence the votes of people in Congress to say, okay, look, if you're going to use this sort of health coverage, it gets so deep.
Yes.
You're running, I assume, my co-host is very rambunctious, I'm sorry. You're running, I assume, to help truly develop healthcare reform, because not only are you boots on the ground, but you have a very good perspective. And is that, because here's the deal, unless people are taking a 6-month or 12-month class on the understanding of the operations of healthcare, I don't know how you can understand it. I think so many people have their hands in the pie. It's just amazingly maybe corrupt. I don't know. Is it the word?
Corruption is one side of it. So it's interesting, and it took a long time for me to understand. And understanding's only one part of it. That's the problem. So we're taught a model in medicine called patient-centered care. And so it's to look at healthcare in the perspective of a patient. What does this patient need? If I'm going to build an appointment, a practice, a medical system, it's based upon, it's a pyramid with a patient at the top, and maybe I'm right there underneath that patient as the physician. So we should design a healthcare system that is meant to give patients the care that they need, and it should help me give patients that care. But there are two very big things that get in the way of that, and that is the healthcare industry and government regulation. And so I guess when you say the industry, maybe we're talking about insurance companies and pharmaceutical companies. That's, probably the two biggest parts of the industry. Today, you could probably also throw in large health systems. And then there's...
What's a health system? Like, is that like a big
well,
hospital
so
system?
like Valley Health System in Winchester has, a whole bunch of parts, where it used to be there was Winchester Hospital, and now it's Valley Health System, that encompasses, I don't know, 6 or 7 different hospitals and all sorts of specialties. So, and then we have the politics of it, where the argument is, well, we have to have a health system that is controlled by government, the single payer argument, versus the free market argument. We need to let the industry, run things, that government is bad. We shouldn't let government be involved in healthcare. And so you see the politics go off in this traditional division. So we've got, the Bernie Sanders of the world saying we should have a single payer system, and then a Republican argument would be, no, we need to let, you can't have government control things like that. The industry needs to be in charge of things. But when you look at healthcare, in reality, we've got problems on both sides. So when I look at that pyramid of the patient and me, there are two entities that get in between that patient and me, or get in the way of me giving, that patient the care that they need. So I'll give you some examples. So first of all, an insurance company. So the insurance company says that only certain medications are approved. So Dr. Hahn, we're measuring the quality of the care that you're giving. And so we're measuring the hemoglobin A1Cs, and we want to make sure if we're going to pay you top dollar, you have to have low hemoglobin A1Cs for your patients. So
low scores?
Yeah, low scores. So the hemoglobin A1C should be under 7.
Okay.
And so you need to do everything that you can to make, on average, your patient's numbers low. Okay, well, I'm going to prescribe a medication, and, oh, that didn't work. I'm going to have to prescribe a second medication. Well, that's not covered. Oh, okay. Well, let me look at a third medication. No, that's not covered. Okay, well, I guess we could try insulin. A lot of patients don't like the idea of doing insulin injections, but, well, that's not covered. So
I'm seeing what's happening here.
Or, even worse, Obamacare addressed a big issue. People didn't have insurance. And we thought that the answer was people need insurance. Well, the new policies have these huge deductibles. So we thought that insurance was the answer, but it turned out insurance, the devil's in the details. What kind of insurance? What does it cover? If it doesn't cover the medications that I can prescribe to take care of diabetes, it's not helping. If a patient has a huge deductible, well, Dr. Hahn, you prescribed that medicine, but I have a $5,000 deductible. I can't afford any of this. So here I am, being chided that I don't give quality care. My hemoglobin A1Cs maybe are too high, and yet I'm blocked every avenue. So that's the industry side. Let's go to the government side.
And it's so busted. That is.
Hello. So
this is already overwhelming how broken this is.
Well, so that's and this is a just one tiny example. So let's go to the government side. So the government embraces this whole idea of, data-driven quality. And so they really push this whole value-based care. They have a whole system that they call the Quality Payment Program. And well, let me jump in first on how we get paid. And this is all determined by Medicare. This Medicare creates the rules that determine how I get paid. So let's say you go to a restaurant, you get a $75 dinner. You give them a credit card. It's done. An average appointment for me is probably about $75 from Medicare. Well, so Medicare says, we need to know exactly what's going on. We need data about what's going on in a doctor's office. So we can't just pay $75. We're not going to just give you a credit card and just swipe it and you're done. We want to know how much work you did and what kind of work you did, or we're not going to pay you. So in 1995, they developed the Evaluation and Management Coding System. And what they did, it seemed so great on paper. It was, they recognized doctors are taught how to interview a patient. I'm taught a system called the History of Present Illness. It's just a structured interview. And it has the chief complaint. It has the quality of the pain a patient's experiencing. It has the location of the pain. It's a very structured interview. And so Medicare says, well, because every doctor is taught this very structured system, let's set up a billing system that's based on the same thing. So that if Dr. Hahn asks 3 questions from the history of present illness and 2 questions relating to the location of the patient's pain and the quality of a patient's pain, and then he asks them 4 questions from different body systems, well, we can actually create an algorithm that pegs certain payment levels to the number of questions that Dr. Hahn asks. Going further, we know that Dr. Hahn and every doctor is taught how to examine a patient. We're taught to look at body systems. So there's the HEENT, head, ears, eyes, nose, throat. There's the cardiovascular system. And, well, let's peg the payment system to how many body parts and how many body systems Dr. Hahn examines. And further, we know that Dr. Hahn is taught a format for organizing his notes called SOAP. Subjective, objective, assessment, and plan. Subjective is what the patient says. Objective is my physical exam. Assessment is my diagnosis and my thinking. And plan is what do I do, the medications I prescribe, the tests that I order, the referrals I make. Well, we'll design a system that it's essentially an algorithm that the more pieces of that whole format that Dr. Hahn uses, the more he can get paid. And so they designed a system, Kevin, that is more complicated than what I do when I see a patient, because the most simple visit that I do is a level, they have a coding system that is broken down into new patient codes and established patient codes. For an established patient, there's 5 different codes, depending on the level of work that I do. For a level 3, the average visit that I do,
You're blowing my mind, okay?
Okay.
So, hold on. So, I own a business. I've got a few government entities that are in my pocket, and that I have to have a certain kind of licensing, certain kinds of insurances. There is some oversight and regulation. Most of it seems kind of logical, but it's about 120% in my business. They could cut it back a little bit, okay? But I'm sending in a report once a year.
Yeah.
Well, on one entity. Another entity, I'm sending in something monthly. But why even be a doctor when they're going to pay you $75 for one visit? You got to pay an administrative assistant at least a certain amount of time to take care of it. The overhead, $75 isn't covering it, man. Like, in my mind, it's not covering it. And you're just scratching the surface on a couple freaking, just a basic exam. And then you're being rated on the success of that patient because it's trackable no matter where that. Screw this, man. Why? Like, why bother?
A lot of doctors are asking that question. The challenge in my practice has been to leverage the technology so that all of this happens in the background, so that I'm not bothered at every moment by this unbelievably intrusive system. Because what I liken it to is, and you know, sort of the way that I wrote my book was about the different voices that were in a doctor's head. In the year 2000, or in medical school, before they tell you all of this horror, there's one voice. It's, okay, how do I diagnose and treat a patient? That's the voice. Maybe there's a second voice, and that's, I'm dealing with a human being. Every patient is a human being, and not only am I looking at them as a clinical entity, but a human being, you know. So those are the 2 good ones. And I remember the first week of my residency, where this wonderful physician, I tell this story in the first chapter of the book, this wonderful physician, Dr. Lejoy, Andre, tells me about the system that I was just describing to you. And he's telling me, so a level 3 visit, you have to have 3 questions from this category. You have to examine 5 to 7 body systems with 12 different points, and you have to have at least moderate complexity decision making. But you don't want to do that because you want a level 4, because a level 4 pays $20 more than a level 3. So for that one, you have to ask 5 questions from the history of present illness. You've got to examine 4 body systems with at least 12 different aspects mentioned, and you've got to, examine this many body parts. And I thought, he's kidding. This cannot be. And it's so now there's this voice as you're trying to see patients. You're literally counting the number of questions that you've asked a patient. You're counting the number of body parts that you've examined. It's confusing, and this is why you understand the title of my book is Distracted. Well, then around 2011, the Obama administration requires doctors to use computerized systems, the EMR. And unfortunately, my company comes to the market late, and the EMRs that get on that get on the market and get market share are horrible. They are more difficult to use. I mean, all of us think that, and this is what people thought, is computerization of medicine is the answer. And it's simple. It's a computer. And it turns out that the computer systems that doctors use today are essentially unusable. They make it much more difficult to focus on a patient's information than if you didn't have a system. And I tell the story about a doctor who was having so much trouble logging into his system, and he was running so far behind that he just started crying. And so now you have this other voice in your head where you're looking at this computer screen, and people complain, all the doctor does now is look at the computer, and he never talks to me. So now you've got the 4th or 5th voice, that we're talking about. And so you see that between the government, and so the government required us to use computers. They designed a program called Meaningful Use. This started in 2011, where you were paid $55,000 over 5 years to buy a computer system, but every year you had to supply data to the program. And it turned out that compiling that data was so complicated and so intensive that it took, again, so much of your focus, because you had to click all these boxes. So I saw a patient, and one of the measures that they want me to report on is if I educated the patient about their disease. So the diabetic patient, I spent some time talking about how we approach diabetic care. We talked about appropriate meal planning. We talked about the need for exercise. We talked about how to use the medications properly. Each one of those things, the government says, well, you need to supply data about that you did that, so you have to click an extra box each time you did it. So not only now are you doing your job with a patient, interacting with them as a human being, thinking what the insurance companies aren't covering, so you have to work around that, thinking because the government requires me to compile this algorithm just to get paid for that day. So now I'm thinking, how many questions did I ask this patient? I'm using this computer because it's required by the government, but it's so confusing just to use that computer that I can barely focus on what the patient's saying. And now I'm clicking extra boxes so I can supply data to the government and the insurance companies to report on all of these things. It's impossible to take care of patients.
Okay, Dr. Matt, you have established thoroughly a pain point in the system. I have to ask, or I'll just state, I assume the only people who are enjoying this system, this way the system works, has to be A, maybe insurance companies, B, software writers, C, the salesman who's selling the system to the government. And ultimately, it's a big jumbled mess. And I am hyper frustrated just understanding what is probably 3% of the problem that you probably could go into far more detail on. So you're running for Congress.
Well, so let me get to that.
Well, no, let me piece it in my brain first, and then you can re-dissect it. Okay, so because what I need to know is, crap. So you have to assume lobbyists are working with groups to influence people who are in power and make decisions. The lobbyists are pushing for the most profitable or influential path there. They're dealing with people, maybe your competitors, maybe people who definitely are either, I guess I can say whatever I want to, maybe too old, don't understand everything you just said, and they're being swayed to make a decision. Too young and have zero experience, and they're going to go on whatever the think tank brings to them, right? That kind of thing. So literally we need about 40 versions of you who understand this in office to make decisions to help begin to turn the tide on such a massive system. Am I kind of piecing that together?
You're getting there. And it's my progression to getting so desperate that I'm running for office. So I say, first of all, I come to politics through healthcare, and now you know why. So starting around 2015, I just became so frustrated with what was happening. And we all think it's that we don't, what's the how do we reform healthcare? That's the national conversation. And I said the national conversation goes in about two different directions. It's, should we have a single payer system, or should we, maintain some version of this multi-payer insurance system that we have? And you never hear the conversation that we just had. So it's missing so much of the detail that it's almost a pointless conversation. So around 2015, 2016, I started writing about this because I assumed the problem is no one understands this story that I just started telling you. So I wrote that book, and it got published, and enough. And I started blogging about it. I started writing a weekly blog around these topics, and doctors were reading it, and it was very popular. And ultimately, I guess a group of doctors started coalescing around a lot of these ideas. And we went down to DC together. We were invited by members of Congress to talk about these ideas. And I would do lectures based on what you just heard, and nothing would happen. You would speak to members of Congress, and you come to understand they are not listening from the perspective of, oh, that's very interesting, I'm going to fix those things. It's not their perspective. It's not the goal. And so we spoke to bureaucrats. We spoke to members of Congress. They're not focused on fixing these issues. And so you start to think, well, okay, so what's driving the system? If it's not understanding the system, if it's not fixing the system, well, it seems like it's these things like the money being paid into the campaigns by the industry. It's the ideas behind all this bureaucracy, so the government bureaucrats and the campaign finance. And I just got so frustrated with that experience where I felt like, man, I put this all down in a way that I don't think anybody has ever put it down before. I think the book is even entertaining in some ways. As imposing as the material is, I tried to make it entertaining and funny, but it's not getting better. It's never getting better. And there's just this, yelling that's going on in the federal government. And last summer, I just broke. There were a number of cases that finally broke me. And there was one evening, I think it was last June, a gentleman I'd known for years came in with his wife, and these patients have told me I can tell these stories, so I'm free to write about them and tell them. And this gentleman comes in with his wife, history of a heart attack about 10 years earlier. Great guy, small businessman, but 64 years of age. That's very important. No insurance. But when you get 65, you get Medicare. And he was a month from the age of 65. He comes in and he says, Dr. Hahn, for the last month or so, every time I exert myself, I've been getting pain in my chest and tightness in my chest. And, well, hey, we understand what's going on. You're at risk for your next heart attack. It's not a difficult moment, medically speaking. You haven't had that heart attack. I'm going to send you to the hospital right now. We'll diagnose it. We'll fix it. Because we work miracles today. That's what we do. Dr. Hahn, I'm not going. No way. What do you mean? I don't have insurance. I can't afford that, and I am not doing that to my family. I will not go to the hospital. But if you don't go to the hospital, you might die. Dr. Hahn, just keep me alive till I get Medicare. That's what you're here to do tonight. And I'm not going to the hospital. I said, yeah, well, I don't have a way to do that, unfortunately. And, I'll change a medicine, but there's no guarantee that what I do is effective. And he said, Doc, I understand. Just do what you can. And so here we are. This isn't a difficult medical moment. Right down the road, I've got a hospital that can fix this guy, but we're denying him care. And we're putting him in this awful position where he is weighing the value of his life against the cost of health care. And it puts me in this awful position where, rather than, again, fulfilling my oath, I have to sit there and with him, balance the value of his existence on the planet when I know what to do for him. I hate that moment. Not 2 weeks later, a woman comes in, farmer. She and her husband own a farm. History of high blood pressure. Hasn't been to see me in years. No insurance. And she comes in because for the last week she's feeling awful. And we check her blood pressure, and it's just, I think it was like 220 over 120, very high blood pressure. And again, hey, I got to send you to the hospital. No, Dr. Hahn, I am not going. Well, here's the problem. If I just put you on medicine, first of all, if I don't get your blood pressure under control quickly enough, you could have a stroke. But if I just give you, pills and send you home and your blood pressure falls too quickly, you could also have a stroke. This needs to be managed in an intensive care unit. It's not difficult. We have medicines, we dial in, we bring your blood pressure down very gradually. Dr. Hahn, I can't do it. We can't spend that money. Once again, here I am with this wonderful family, and we are forced into this horrible circumstance where we have to weigh the value of her life against the excessive cost of, readily available medical care. Beyond frustration. And again, to think that the quality of my care is being measured, so blood pressures are being measured, and I'm paid based on the level of blood pressures of my patients in my practice. And yet there's no way I can get them the care that they need in this system. And it broke me. It just broke me. And I said, I can't take this anymore, and I'm not going to do this anymore. Politicians are busy yelling at one another and fighting with one another, and these people are suffering. And it's the year 2020. miracles at my fingertips. We know so much more about taking care of patients today than even when I started out 20 years ago. And these treatments, these diagnostics are readily available. And yet people are suffering, they're going bankrupt, they're dying at the hands of this broken system that never gets better. And all our leaders seem to be able to do is fight with one another. And, you know, I'm just sick of it. And so I decided to run based on those two experiences and these years of developments that I told you about.
I can't say it enough how much I love my podcast, because it brings things to the surface that I had no freaking clue about. Okay. And your stories are so convincing. They're so compelling. I hate to hear about those two families that have to choose one or the other. And then I hate it for you, because you have that personal connection to all your patients. You in the style of treatment that your practice provides, you take it even harder than just somebody who's processing the numbers.
These are my people.
Yeah, and then reflecting on why you wanted to be a doctor in the first place. Now, my version of a doctor, right? Oh, here he comes again. My version on a doctor is what you see on Grey's Anatomy, ER, Chicago Hope. There's no sitcom that shows the amount of freaking paperwork, not even paperwork, computer work. But now I know why they're asking me questions, not looking me in the eye, and literally just click, 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 and just work in this little mobile computer. And it all just seems normal to me. But the sheer quagmire of what's happening behind the scenes, it breaks my freaking head. Now, here's what I need, man. And I had this whole list of how I was going to go down this podcast interview. And thank you for taking the lead, because your way is way better than mine. When you win, how are you taking like a team of frustrated doctors with you? Are you going to go, and how are you going to convince people? How are you going to turn the tide? Or are there people or mentors ahead of you already doing it?
Well, let me tell you one other piece of the pie, because then there's the politics. Okay. So and you know what you're experiencing is just what I've gone through in 25 years, where I came into the system just full of hope. You know, oh my gosh, I'm going to be a doctor in the greatest healthcare system in the world. And, you know, and I'm a doctor. It's great. I mean, I'm Jewish. My parents, when I was in a rock and roll band, they weren't chagrined, but let's just say that it wasn't what they had wanted for me. And when I went to medical school, oh my God, I remember when I graduated and I turned around, I was walking on a street outside of GW, and I had my daughter was a little baby. I was pushing the stroller, and I turn around and I see my mom's face, and the smile on her face was so broad. And I was like, oh, okay. All right, Mom. She's, you know, my son's a doctor. And, you know, this is what I thought I was getting involved in. And it turned out to be what I'm telling you. And so then the question is, how do we change things? And how come when we know all this, how come when I can write that book, but how come when we've solved the major challenges? You know, the real problems in medicine were, how do we diagnose and treat patients? And we've made these unbelievable breakthroughs, and you think that's the idea, that's all you needed. And you think, well, we've got computers, this is easy. How come it's getting harder? How come it gets worse and worse? And so how do you change the system? And I had another breakthrough moment, a whole other thread I haven't been talking about. So I'll tell you one other story, and it touches on the theme of division in America and division in American politics. So last summer, well, let me set the stage. You're familiar with the Rockwall plant that's being built. And there are two sides fighting about this. There are the people that say, hey, we need jobs. And this is a plant that's opening up that's going to have a 120 or 125 good paying jobs, I think. And there's nothing more important than that. We need this. And then there are people on the other side that say, well, we don't trust companies like this to police themselves, and they're working with these chemicals, and they could endanger our water or our children. And there are great examples of this happening. That's concerning. And let's see, the rest of the stage. Oh, there's a Representative Espinoza probably in your district. And last summer, he accepts a job with the Rockwool company. And that kind of bothers me because conflict of interest is a really, really important issue, and especially in medicine, where we talk about conflict of interest all the time. If a doctor is a researcher and does a study, who paid for that study? Is he working for a pharmaceutical company? And my generation of physicians was taught, you've got to be very careful about your conflicts. And so I'm a physician who, if I wanted to, pharmaceutical companies come to my office almost every day. And if I wanted, I could be taking lunches, trips, all sorts of things. And, to the point where I could be literally bringing in thousands of dollars of value into my practice every year. And I refuse to do that. Those pharmaceutical reps are not allowed past the front window. I accept no gifts. I accept no meals, nothing. Because my integrity when I'm in a room with a patient is one of the most important things to me. And if a patient felt that I prescribed a medicine because I had had lunch with the rep for that drug the day before, that would horrify me. So, and here in the campaign finance system of this country, we have allowed this whole concept of conflict of interest to be bastardized. We have a political system that essentially functions on conflict of interest. It bothers me a great deal. So last summer, Representative Espinoza takes a job with the Rockwool company. That really bothers me because I think there's some real big conflicts right there. So the rest of the scene is my wife asks me to build a patio last summer. I was building the patio. It was 98 degrees every day last summer. And my mother-in-law, my dear mother-in-law who lives in Shepherdstown, had an operation on her knee and she needed dinner that Saturday night. I had worked all day on the patio. I was tired. I was hungry. I was hot. My wife and I drive into Shepherdstown to pick up dinner for my mother-in-law after this long day. And there's a protest taking place. On the left side of the road are the anti-Rockwool people. On the right side of the road are the pro-Rockwool people, and they're holding up Espinoza signs. We favor this idea. Not only do we think that jobs are important, we're glad that Representative Espinoza has taken this job. That just flipped my switch in a way that my switch has not been flipped before. I park the car. I run to the biggest guy holding an Espinoza sign, and I start yelling at him. And about 30 seconds in, I realize, Dr. Matt, you're an idiot. This is stupid. You don't do this. This is dumb. Don't yell at this guy. You're defeating your own purpose. You're doing something you shouldn't be doing. I stopped. I went across the street and some people, I talked to some of the anti-Rockwool people, and I apologized to them for doing what I did. And I went back to the fella who I yelled at, and I apologized to him. And I said, you know what, I'm really sorry. That was stupid, but I want you to understand why I'm really passionate about this. And let's talk about it. And we did. And it wasn't a great conversation, but we did talk about it. And I came away from that moment realizing there's a disease in this country, this whole division that has taken hold, where you're either left or you're right, you're Democrat, you're Republican, you're, conservative, you're liberal. It's become a disease, and now I've got it too, to the point where a rational, caring individual is running up to people and yelling at them, almost getting into a fight. And I realized this has to stop. This is not working for us, and it's viral. I've got to run for office, and I'm going to do it in a way that attacks the problem, the root problem of why healthcare is never getting fixed. And it is all of the things that create division in this country. And that's how I got to that final moment where, all of the great reasons that you shouldn't run for Congress, I said, I don't care anymore. I'm running. I'm running because my patients mean a great deal to me. I'm running because my daughter and my daughter's generation mean a great deal to me. And the American dream has died for that generation. And it's died for a lot of people. And they're so angry over things like that they're, they deride each other in such awful ways. And it's got to stop. We are going down a path in this country where this division is taking over everything. It means that we don't fix healthcare. It means that people don't get good jobs. It means we do nothing about the opioid crisis that's been raging in our community for years. We don't do a thing. It means we don't fix roads and bridges. It means that this generation, my daughter's generation, may never own a home, may never have retirement. Who knows if they'll ever have health care? Maybe, we've got to fix this. And I bring together all the different threads where I say, look at healthcare. We're capable of miracles. And yet, somehow we have figured out how to withhold those miracles from our patients. The technology that we have today, the fact that you and I are talking over this, we're capable of anything. And yet the division has gotten us to a point where we're getting nothing done. And I said in my opening speech, in my announcement speech, the United States of America was once the nation that could do anything. You think about the fact, we won World War II, we go to the moon, and growing up in that country, so much pride. We can do anything. And same thing in healthcare. And yet this division where we approach every issue as two sides that are going to fight one another to the death has gridlocked our nation. Nothing is changing. We're getting nothing done, and it is endangering us. And so I announced my candidacy in December. And one of the things I talked about was that gridlock is endangering us. And we've really, rather than, fighting one another tooth and nail over every issue, we've got to figure out ways to get along. And, I looked in an interesting place to try to figure out how I was going to approach this campaign, how I was going to talk to people, because the last thing I want to do, because I first of all, I don't like doing it, and I also think it's ineffective, is just list the, 5 issues that are important to me and say, I'm for this, I'm against that, I'm for that, I'm against that. And you just, see which of those issues you agree most with, do I align with your checks, and you vote for me. That's not effective politics anymore. And also it's not a way to win. And so I thought, how am I going to talk to people in a different way? How am I going to get elected? so that we can change these things, because with our current leadership, nothing's changing. And the current leadership style, nothing's changing. And I looked to the Bible because it seems like such an integral part of so many people's experience. And some basic lines, you know, in the Bible. House divided against itself will not stand. Jesus says that, you know, my most important commandment, love thy neighbor as yourself. These are the answers. These basic answers. And if we don't get to a point where we are operating on that level, we will never fix the challenges of the 21st century. And then we come to the coronavirus, which is the perfect example of how broken our current approach is. That we hit a challenge that our system is not up to. That despite the fact that we understand the nature of this virus, that we can bring all sorts of amazing things to bear across the spectrum, not just in diagnosing and treating the virus. We can't do it. Our system, our institutions are not up to the task. And we're in danger because of it. And we're divided. It's terrible. And if we don't change, we face losing so many things we value, even our lives.
Dr. Matt, your passion is on point. I love hearing it. I love hearing the passion. I love all the motivations you've got. You've given me so much to think about. For a second, let's talk about the logistics of running. I saw your name was on a list that you're not taking. What's the word? Like campaign funding?
Yeah, super PAC money.
So you could be eligible for super PAC money, but you choose not to because you believe that's part of the problem.
Yeah, we were a nation that was formed out of values. And we have forsaken those values. Like I talked about, conflict of interest. And it is both wrong from a values perspective, but it's also destroyed the system where our elected leaders do what those with the most money tell them to do. And it's, you know, for the most part, it's not a damn thing. So if I'm going to run for office, I'm going to do it the right way, where at the top of the pyramid of the things that I'm thinking about, it's values. And I'm going to uphold those values. So no, I'm not going to take corporate or super PAC money. And it definitely means that I won't have the kind of money that a lot of politicians raise and that they base their campaigns upon. But I don't care. And you and I met when I was beginning the brunt of my campaign. I decided, I thought long and hard about this. In fact, I had a Tom Cruise show me the money moment. What's that? What was that movie? Oh, Jerry Maguire. I had a Jerry Maguire moment in mid-January after I had announced my campaign, and I was starting to try to raise money. And I'm a full-time physician, and I have to be a full-time physician. I can't abandon my patients for this run. And I was spending every moment making phone calls, trying to raise money, and I was raising money, but not nearly the amount that most politicians raise. And one night, I was up all night, just like Tom Cruise was in Jerry Maguire, feverish, thinking, what am I going to do? What am I going to do? And a few things I guess, came to me. One is the notion, I'm running against Alex Mooney, and what people say to me about Mr. Mooney more than anything, and I'm not here to deride Alex. I'm not here to tell you bad things about him. That's not what I'm going to do. I don't like it. I will not negative campaign. This is about what I want to do, rather than me telling you, anything bad about him. But what people say is, we never see him. He's been in office 8 years. I've never met him. I was doing, actually, the night that I was up all night, I was doing a press tour in Charleston. And every member of the press I met said, he's been in office 8 years. We met you first.
Where does he live?
What's that?
Where does he live?
Harper's Ferry, I believe.
Oh, so one town away from
He's
me.
your
I've
neighbor.
never seen him either.
Yeah. And so I decided, well, there's an answer. I'm a runner. I'm going to run the entire district. I'm running door to door. And that's both because it's free. All I need is my own, energy, and I've got lots of it, and my passion, and my message, and it's free. So that was my answer.
So here's the deal: when it comes to fundraising, you need funds. So our ARP, and on this podcast, I can flash up throughout your story what link to click on if people want to donate to your campaign. Is that something we want to?
Absolutely.
So I assume you have a page set up, like a web page that allows people to donate there. All right, good.
Matt,
so we'll put that in the
Matt-HahnForCongress.com.
Okay, yeah, we'll put that in the show notes for sure.
Yeah.
But look, Dr. Matt, you've given us so much to chew on. This has been the least I've spoken in any podcast, frankly. It's been awesome.
I apologize.
No, don't apologize. It's been a constant stream of education, which is what I'm thirsty for. So we've covered every topic I wanted to cover besides one. And that is, explain to people listening who's voting for you, as in the district. Like we already said, you're primarying against Alex Mooney.
Right.
And he has the budget for commercials, I guess, and signs and all that sort of stuff. But I don't know how to get a hold of him. And if he's not talking to anybody and no one's ever seen him, then I'm probably not going to get a hold of him to be on my podcast. But please explain to us how the district works and who is going to be voting for you during the primary.
Right. So this is the United States Congress, West Virginia 2nd District. West Virginia has 3 U.S. congressional districts. This is the 2nd District, which extends from Harper's Ferry on the east all the way across the state, a narrow strip all the way across the state, through the Eastern Panhandle, and all the way to Charleston.
Oh, wow.
It's a very long, so it's a 300-mile plus district. And this is the primary. So, of course, we have a Republican and a Democratic primary. The people who can vote for me in the primary are either Republicans or independents, because we get either a Republican or a Democratic ballot. And an independent in the state of West Virginia has to say which ballot they want. And so I'm hoping that lots of independents say, I want the Republican ballot. And, in the choice between Hahn and Mooney, I choose Hahn. So Republicans and independents can vote in the Republican primary. And if I win the primary, then it goes to the general.
That's a very good answer. Thank you for that. And then it's a unique situation right now because everybody's requesting their vote from home ballots. So you have to kind of know ahead of time which one you want. And I find that a little bit archaic because I might want to vote on the Republican side for some of the categories and the Democratic on some of the other categories. Maybe one day this system won't be so difficult and antiquated, but I get one challenging system at a time, Dr. Matt. One system at a time. Well, look, I think we could wrap this up. Is there anything else that we didn't touch on that you really want to let us know about? And it can be a long story. I'm just saying, I don't know where to go next with this besides encouraging people to look at this podcast.
Talking about the division, I think, is really, really important. We need to really think about this because so many people, and this is on, this is on both sides. If there are, just two sides, this is on both sides, that we have gotten to a point where our views invalidate the other side's views. And let's say we're close to, split 50-50. First of all, as I said, this has gotten dangerous. We can't get health care. So if you have a health care issue pop up, people die over the fact that we have a broken system. But, this animosity that we've developed for one another, it's not going in a good place. It's almost as if we're having a bloodless civil war where, anything that somebody says that's identified with one side, the other side automatically invalidates. Almost like, you don't count. I won't listen to you. This goes in a very bad direction for this country. But even more than that, it means that we're never going to be up to the challenges of the 21st century. Even if let's say the Democratic presidential candidate wins, well, then all that happens is the Republicans line up on the other side and do everything they can to invalidate everything that Democratic president does. And then the next time, the Republican president wins and the Democrats line up on the other side and try to invalidate everything that, and this isn't working for us. This means that we're not taking on the challenges of globalization. We're not fixing healthcare. We're not educating kids. We can't even agree whether or not we have climate change. And really, we're busy fighting 20th century problems and we're using 20th century ideas and institutions. And the 21st century is 20 years old and we ain't up to it. And it endangers us as individuals. It's endangering our country. It endangers our place in the world. You think that a country like Russia or China doesn't notice that we, in the face of this virus, that all we're doing is devolving into a brawl? They notice. And this is not good for us. Let's say it's not just a viral challenge, but let's say there's a military challenge to this country. We got to work together. If we do not work together, if we don't find ways to work together, what I talk about is we have to look at issues not in ways that help our side win or help our my ideology win. We have to look at issues in ways that both uphold our values and enable us to move forward together. If we don't do that, we stand to lose so many things that we value. And we've got to get past that. That's why I'm running. That's how I'm running. I don't know if I'm going to be successful, but I'm not going to be the person who didn't do anything. And I'm not going to be the person who just lines up on one side anymore, because last summer I learned, that it's not good for me. It's not good for anybody. And again, we know so many things today. We live in an age of miracles. In healthcare and everything, once the world was dominated by scarcity. So you had cancer 100 years ago, sorry about your luck. But today, I can diagnose it, I can treat it, And yet, I can't give you any better care than the people got 100 years ago. If we put our minds to it, if we learn to get along and we, maximized our capabilities, we could do anything. We could have a society of miracles. We're not doing it. And if we don't figure out how to do it, we continue heading down this very, very bad path. And it's not just going to be, the virus, as I said. So my campaign theme, together we stand. God has given us a very simple task. We got to love one another. We do that, we can do anything.
That's great, Dr. Matt. What events or any sort of Zooms or Facebook Lives or anything like that do you have scheduled or coming up, or where can we find more information about those?
Well, so yeah, head to my Facebook page, head to my website, matt-hahnforcongress.com. So matt-hahnforcongress, hahnforcongress.com. And also, as an expression of my commitment to working together, what you'll be able to see on Facebook upcoming is a Facebook Live race on May 30th. Kathy Kunkel, my Democratic opponent, and I have decided to team up. Rather than tearing her down, I'm not going to tear her down. She's a very nice person. And we're working together to raise money to fight childhood hunger because of the COVID-19 outbreak. And kids being home, the Boys and Girls Clubs of the Eastern Panhandle are feeding 3 times the normal, or providing 3 times the normal number of meals to kids every week. And Kathy and I have decided to do a fundraiser, and that fundraiser culminates in a running race. At the end of the month, we're running 1 mile at Morgan Grove Park. It's going to be Facebook Live event. And I think I'm going to win. I've been training pretty hard. I've got my mile time down to, on a good day, a 7-minute mile, that's really good for me. I've been running for years, and I'm a great runner, but a really, really slow runner.
So tell me, you're in a running group. I started a running group. We have hundreds in my running group. I'd love to see that event and then promote it inside my group. I think they'd love to come out to something like that and not only support you, but run beside you and encourage you.
Well, except for social distancing. So I don't know. Yeah, see, this affects everything. So my door-to-door campaigning had to stop. And that's why this is a Facebook Live event. We want people to donate because we're shooting for at least $10,000, but I think we could raise much, much more. And yeah, get involved. If you go to my Facebook page, Matt Hahn for Congress, you can see the donation link. If you go to the Boys and Girls Clubs of the Eastern Panhandle website, there's a donate link. And there's a great video that we put together highlighting the shock and horror that both Kathy and I experienced when we learned that we share some things in common. Despite the fact that I'm a Republican and she's a Democrat, we found out that we both love running, which was, I didn't know that the two sides could have anything in common. And neither of us likes the idea of hungry children. So I was shocked to find out that Republicans and Democrats share certain views that they can agree upon and even work together. Now, we're racing, and I believe I'm going to beat her. In fact, I think it's genetically impossible for a Democrat to beat me in a race like this. I believe. I could be wrong, but it's a good video that we put together highlighting the shock and horror that we both experienced in learning that we both care about children, and neither of us likes them going hungry.
I look forward to sharing that link. I'll definitely put it in there. Dr. Matt, thank you so much for being on the Break It Down for Brackens podcast. I have been so educated today. This has been so frustrating, but so enlightening at the same time. So thank you very much for being on. Again, I'll put all the links and in the show notes and whatnot. And again, feel free to share this as many times as you want to prior and in any venue as well. I mean, this is for you to use as well. And you've really done a great job of communicating probably a small percentage of the frustrations that you guys have. So I think that wraps it up.
All right.
Thank you very much. I appreciate it.
All right. Take care.
You too.
This podcast is brought to you by City National Bank in Ransom, West Virginia. I am Melissa Knott and manage both of our Jefferson County locations. Our Charlestown location is located on George Street in Charlestown, and the Ransom location is located in the Potomac Marketplace Shopping Center. City National Bank is a full-service community bank that provides an array of financial services. We offer a range of free checking accounts and savings products for both consumer and business customers. City National Bank offers competitive low-rate and low-cost lending products for both business and personal needs. Come and talk to me or one of my team members and get products and services that are tailored to fit your schedule and help you to achieve your financial goals. I can be reached at both the Ransom and Charlestown locations. Check out our website at www.bankatscity.com.
Have you heard of Brackens painting? I started Brackens painting back in 2011. We do both residential and commercial painting. We have contractor's licenses in West Virginia and Virginia, and we carry all the necessary insurances like workers' comp, general liability. We operate a small staff that focuses on meeting the homeowner's needs and project managers' timeline expectations. We try to have exceptional attention to detail. If you're interested in doing any sort of commercial or residential painting, please contact Brackens Painting. More information can be found at www.brackenspainting.com.